The pancreas is located near the stomach and duodenum. The right lobe extends along the descending part of the duodenum, adjacent to the right abdominal wall, ventral and lateral to the right kidney. The caudal portion of this lobe disconnects from the duodenum to position itself more medially. The body of the pancreas is short, between the junction of the right and left lobes. It is just caudal to the gastroduodenal junction and ventral and to the right of the portal vein. This vein represents a useful landmark to locate the pancreas. The left lobe is slightly larger and extends caudal to the stomach into a triangular zone whose sides are made up of the spleen, laterally, the left kidney, caudally and dorsally, and cranially by the gastric fundus. The left lobe partly follows the splenic vein, which flows into the portal vein on the cranial side. The left lobe is partly buried in the fat of the omentum and mesentery, which makes it more difficult to identify, at least in dogs. In cats, the normal pancreas can be found more consistently, in part because of the better visibility of the pancreatic duct that extends in the central portion of each lobe. The pancreaticoduodenal veins, along and across the right lobe of the pancreas, facilitate identification, especially in dogs. In the dorsal view, we can see how close the right lobe of the pancreas is to the right kidney and duodenum, as well as how far it extends cranially under the costal arch, which limits our access with ultrasound. The liver is also close by, enabling us to compare respective echogenicities. The gas and feces in the ascending and transverse segments of the colon, which appear in green here, can limit the identification and evaluation of the pancreas. The air in the duodenum and stomach can do likewise. The body and left lobe of the pancreas can be identified in the transverse plane with respect to the main portal vein, which can be followed from its intrahepatic branches. The view of the portal vein can be interrupted due to reverberation artifact coming from the pyloric antrum. The portal vein is easy to see just caudal to the pylorus. Once you locate the portal vein, you can focus your attention just ventral to it, or you will see the proximal portion of the left lobe. When the pancreas is normal, it will be difficult to identify because its echogenicity is similar to the surrounding fat tissue. Fortunately, when the pancreas is abnormal due to disease, its echogenicity will usually change, making it more conspicuous. Observe how close the transverse colon is. It moves in and out of the image due to the patient's breathing. The left lobe of the pancreas extends into a region that is limited caudally by the left kidney, ventrolaterally by the spleen, and cranially by the stomach. In some patients, you can also follow the splenic vein from the spleen all the way to its destination in the portal vein, scanning at the same time the region of the pancreas. Using this landmark can help detecting subtle pancreatic lesions. The portal vein and the pyloric junction can be used as starting points to locate the left extremity of the body of the pancreas. By keeping a transverse scanning plane with respect to the pylorus and proximal duodenum, we can complete the examination of the body of the pancreas. Next, following the path of the descending duodenum as it goes along the right body wall, the right lobe of the pancreas can be followed and examined. In a transverse plane, the right lobe often appears triangular and displays an anechoic vein that traces a sinuous path across the organ. The pancreaticoduodenal vein is a useful anatomic landmark. Note that the liver is slightly hypoechoic to the pancreas. The liver is located laterally and the ascending colon medially to the pancreas. A few segments of the jejunum also appear on these images. Caudally, the right lobe departs from the duodenal wall and moves toward the center of the abdomen. Observe the presence of the right kidney, located medially and dorsally to the right lobe of the pancreas and the duodenum. Finally, the right lobe is examined in the longitudinal plane. The normal pancreas can be isoechoic compared to the adjacent liver, or slightly hyperechoic as in this dog. Observe the winding path of the pancreaticoduodenal vein as it crosses the pancreatic lobe. As mentioned previously, the pancreatic duct is more often visible in the feline pancreas, even when normal, which helps us identify the pancreas in this species. This is contrary to dogs in whom we can rarely see the duct.